The COVID-19 pandemic continues to be a source of anxiety and upheaval for everyone. One of the main consequences of the disruption to normal life includes widespread deferment of care. People not initiating, delaying, and in many instances, stopping their treatment altogether. Patients from underserved communities are among those who are most impacted by this disruption. I'm very pleased today to speak with Dr. Kemi Ali, Chief Executive Officer of the Henry J. Austin Health Center in New Jersey. Back in March, prior to the start of the pandemic, we were able to support the New Jersey Primary Care Association's vision of telehealth services. I'm very excited to be speaking with Dr. Ali today. Dr. Ali, welcome.
Good afternoon, and thank you for this invitation.
I'd like to start off with a simple but important question. How has COVID-19 affected your organization and what you're able to do for patients?
As the pandemic unfolded in middle of March, we very quickly realized, as you were saying in your opening remarks, that patients were not coming into the center, and rightfully so. There was anxiety, there was fear, and caution on the part of our patients of not wanting to come into the health center in the beginning of a really scary, unknown pandemic. And so we use the Novartis funds to really help shape our organization, provide the infrastructure for telemedicine or telehealth. And we found, surprisingly, that there is this interesting increase in the number of individuals who accessed our providers and teams through telehealth. And so that was very surprising that there were many incidences where patients we hadn't seen for years, patients that were actually lost to care, reached out to us because now they had access and they could do it from their homes. We also had to be really cautious, though, about those individuals that have challenges with telehealth. And so that's why it was really important at the beginning that we created an infrastructure of staff, whether that was community health workers or medical assistants or patient navigators, to really help our patients navigate the telehealth world.
How are underserved communities being disrupted by the pandemic, and what are their biggest concerns right now?
The disruption is unique, particularly in those underserved communities in impoverished inner urban, but also rural areas as well. Part of this disruption is, so much now is virtual, not just healthcare, but also the educational systems as well as work. And so if you're in a disenfranchised environment where you don't have access to broadband, to Wi-Fi, to real effective internet access, then that chasm, that divide widens even more. And so that's a major disruption. And that's really important, when we think about healthcare and having access to healthcare, particularly during this time of the pandemic, it's really important in the underserved communities because of the healthcare disparities they're already facing. So as we know, people of Black, brown, tan skin colors are disproportionately affected by the pandemic, higher morbidity and higher mortality rates. I know in our city of Trenton, the individuals going into the emergency room right now and the individuals being hospitalized and in the intensive care unit, it's 50% the Latino population, but they only make up 30% of our community. So again, just disproportionately affected by the pandemic.
Let me ask you, how can the pilot program that you're running in telehealth, how can it be used even more broadly among underserved patient population? And are factors such as broadband access or language barriers, are they more or less common than you might have expected?
That is an excellent question. And I think to answer the first part, yes, it's what we expected within our community in terms of those pockets of lack of broadband and how we overcome that as a community is something that we're looking into right now. One of the real interesting things we're looking at is setting up telehealth kiosks throughout our city. And so setting them up in locations where there's a trusted relationship with the community and that organization. So for example, at our area soup kitchen, setting up a kiosk there because we know that's a trusted relationship with the homeless population and they go there every day and they really do trust the staff and that organization.
You mentioned trust just now, Dr. Ali, and I wonder if you could talk to us a little bit more about that in the underserved communities.
When you have a certain trust in federal or governmental authorities, it's sort of taken for granted. And I think that is in our society, there are individuals that the same thing applies to healthcare, that we trust when we go to our doctor, that he's going to give us the information we need and help us make the decision that's in the best interest of me as an individual. Well, people of color, people of immigration status, people that are foreigners, know that that's not always the case, unfortunately.
So let me ask you, looking back at the past year, Dr. Ali, how has telehealth changed since the beginning of 2020? And what are some of the lessons that you've learned as you look to the future of telehealth services?
It's really changed dramatically. So when we started in the early months of March, right at the beginning of the pandemic, we weren't really sure what we were getting into, right? And how this was going to be received within our community. And as I've said, over the months, our telehealth, telemedicine platforms have just grown dramatically in terms of the number of individuals that access the system. But we've also learned that does not necessarily mean you don't need the same amount of physical, personal communication and touch as well. And so by that, I mean, you need the processes, the workflows, the teams to really make the telehealth, the telemedicine platforms work, particularly when you're talking about communities like that in Trenton. So again, impoverished communities, disenfranchised communities, communities that have been for so long part of this digital divide. You need a structure to support them in accessing, sustaining, and really enhancing their access within the telemedicine platform. And then also, we've talked about this issue of there are still some individuals that really do need a face-to-face in the midst of the telemedicine, telehealth. And so it's not going to be the answer for everyone. It does increase access for many, but not for everyone. And so we then, institutions, have to really strategize and be intentional of how you create this hybrid delivery system. I don't think we're going to be able to go back. I think it's going to be an expectation for many that, no, I can be at home on my sofa and see my doctor. and that's an expectation. And so we're really going to have to strategize of how we create these hybrid institutions everywhere, whether that's specialty care, primary care. How do we create this new hybrid world of delivering healthcare? And as we do that, how do we make sure that everyone gets the access they need?
I couldn't agree more, Dr. Ali. And I just want to say that Novartis is committed to helping you to achieve exactly what you said. I hope in the future that we can learn from this pandemic, from the telehealth program that you've put in place for the New Jersey Primary Care Association and for the community health groups that you represent. And I want to thank you so much for speaking with me today and for sharing your perspective with us.
Without support from foundations like yours, from institutions like yours, we would not be able to do what we do for so many. So thank you.
We're just very proud that maybe our first important partnership was with you and the New Jersey Primary Care Association. So thank you. Thank you very much.
Thank you.